Hello, good afternoon everyone. Today we're gonna discuss about the instant information consent in clinical trials. This information is provided to potential participants through a informed consent process. Informed consent means that the purpose of the research is explained to them, including that their role would be and how the trial will work. A central part of the informed consent process is the informed consent document. In a simple term, we can say that informed consent is a process of communication between you and your healthcare provider that often lead to agreement or a permission for care, treatment, or services. Every patient has the right to get information and ask questions before the procedure and treatments. There are mainly four components of informed consent, including decision capacity, documentation of consent, disclosure, and competency. Competency. Doctors will give you information about a particular treatment or test in order for you to decide whether or not you wish to undergo a treatment or test. According to ICH-GCP 1.28, define informed consent as a process by which the study subject voluntarily confirms his or her willingness to participate in a particular trial after having been informed of all aspects of the trial that are relevant to the subjected decision to the participants. Why the informed consent is important for the clinical trials? Informed consent is often to assure the research that the participants know every aspect of their participants in trials, what the procedure or treatment are given to look like, and the potential outcome, including the benefits and risks. Obtaining the informed consent also benefit the research staff. I will explain with some example. I have had the opportunity to ask question about this research and I have received satisfactory answer. I understand the general purpose, risk and method of this research. I consent to participate in the research project and the following has been explained to me. The research may not be of the direct benefit to me. This is one example to know the informed consent in research. There are some different type of consent. It required an individual to provide a clear and specific permission to the process to their data. There are various type of consent, including the explicit consent, implied consent, option OPT in consent, and OPT out consent. The type of consent required depend on the context and the applicable data protection law. The informed consent in the process of telling potential research participant about the key element of a research study and what their participation will involve. The information consent process is one of central component of the ethical conduct of research with a human subject. There are some steps to get the consent, informed consent. The following are the required element for the documentation of the informed consent discussion. First, the nature of the procedure. Second, the risk and benefit and the procedure. Third, reasonable alternatives. Fourth, risk and benefit of the alternatives. And fifth one is assessment of the patient understanding of all elements through 1 to 5. Adults age more than 18 or older are generally assumed to have a legal capacity to give a consent for medical procedure or treatment. Sometimes mental illness or disabilities can affect an adult legal capacity. The entire informed consent process involves giving a subject adequate information concerning the study, providing adequate opportunities for the subject to consider all options, responding to the subject questions, ensuring that the subject has uh, compared his information, or obtaining the subject's voluntary agreement. Thank you.